leading the Nigeria Center for Disease Control during this pandemic has really been a challenge and a privilege. In the first place, this disease is new, like we know, but also challenging in its clinical presentation. The fact that it has such a wide spectrum of how it presents, from one extreme of being completely asymptomatic in a wide majority of patients, to presenting in a very aggressive clinical pathway that leads to very rapid deterioration and sometimes death. And the fact that you don't know where each new infection will take an individual that has got it. Why do I say that in relationship to testing? It means that it is very important for us to understand that people are infected so that we can quickly monitor them, and if they're likely to deteriorate, get them into care. So the most important part of testing is to enable care happen, right? So testing is not, we don't test for the sake of testing. The two purposes of testing: one is to manage the individual so that we can get you into care quickly and make sure that you have access to those things that are most likely to keep you alive. But secondly is the public health aspect, to then prevent you from transmitting to people in your network. And remember, the most likely people for anyone to transmit to are their friends, their families, their loved ones, because those are the people you spend time together with. So remember, testing is not just something to count how many tests you've done. Testing is the pathway to, one, saving your own life, and secondly, preventing people from transmitting to others. And that's why we've really focused on improving access to testing in Nigeria, and have done so fairly well. But we are not where we want to be, so we have to keep this message going out there to encourage people not to be afraid. If you've been in contact with someone, if you think you might be at risk yourself, to access the many pathways we've opened up for testing in Nigeria.
What is the failure with testing in Nigeria, the issues that we have with testing in Nigeria?
We've worked very hard over the past 10 months, increased the number of labs in the country so that the more than 80 labs, over 60 public sector, the rest are private sector or universities, to increase the number of labs in the country. We've also sustained a supply chain to all these labs. But Nigeria is a big and complex country. Many states are big, and not all the cases are in the state capital, for instance. So even though you have a test in a state capital, a lab, you still have to travel in. So we admit there's still challenges of logistics and access. And also, I think there's other aspect to it is there's some level of apathy among people. Initially, there was a lot of fear, and now it has gone to the other extreme. So we're continuously working hard. There hasn't been any. Right now, our warehouses are full. We have commodities, reagents. We continue supplying all the labs in the network. So we keep doing our part. But this is not just NCDC. We have to work with state governments to make sure the facilities are available. People come to work on time. People are available to collect the sample. So there are many parts of this triad that includes citizens, includes local health colleagues, includes NCDC. And unless all of us are working in sync, it might not be comfortable for everyone. But I think, in summary, we are not where we want to be, right? But I think we've made a lot of progress from where we were in February and March. And the challenge now is how to sustain the improvements consistently, keep the pressure on, don't drop the ball across government so that we can really improve the whole public health architecture in Nigeria. The so-called non-pharmaceutical interventions that we have advocated as a response strategy, keeping a minimum of 2 meters distance apart from each other, wearing of face masks, enabling ventilation in rooms when you have to meet inside, washing our hands frequently is very important. And we also recognize that it's a challenge for us because as Nigerians, we love to socialize. We live together, eat together, dance together, we pray together. This is how we have learned to live. And so it's been very difficult to live in a context where you're not allowed to do these things. So the message hasn't changed. We have to remain consistent. We've really appealed to all parts of society, leaders in society, whether you're a church leader, to please enforce these measures in your church, whether you're leading a company, to ensure that people working in that professional space are doing so, to families that would normally invite lots of guests for the weekend, to please, if you have to do that, limit the numbers and hold it outside, so that these measures that we have to keep doing, as inconvenient as they are, because the alternative is too worrying to even attempt thinking about. You know, we don't want our hospitals overwhelmed with cases again. So we have to do these things. But there are some aspects of it, honestly, that I hope that we sustain. You know, when I travel at an airport now, I see people queuing up nicely, washing hands frequently. I think that some of these behaviors that I hope that as a society we sustain way beyond the outbreak, so that even when we have a vaccine and we can, remove the mass, there are things that I think we can do away with. But there are things I hope we can sustain, because they not only prevent COVID, they prevent the transmission of many other infectious diseases.
Okay, another question I would like to ask is, what's your take on drive-through testing? You know, a lot of countries do it now. What do you think? Can Nigeria also imbibe that?
Drive-through testing already started in some places in Lagos, in Naima, very early in the outbreak. And right now, we have it in Naima and in the National Reference Lab in Abuja in Lagos. So drive-through testing, the only difference is that people stay in their vehicles when the sample is collected from their noses and throats. Apart from that, everything else is very similar. So I agree. I think the general answer to your question is that we have to make it more convenient for people to test, right? And that really is the critical question. How do we make it easier for people, reduce the inconvenience in testing, and make sure that people can access testing comfortably wherever they are? And that's something we'll work on and continue working on at NCDC.
Okay, I also want to ask about the second wave. What is the preparation that NCDC is doing concerning the second wave of COVID-19?
Our primary strategy is to prevent a second wave. A second wave is not inevitable, right? We can prevent this by the work that we do. We have implemented some of the strictest pre-entry measures in any country. We insist on 2 tests, one before travel and one 7 days after arrival, to firstly make sure you don't have the disease. You're not bringing in the disease into the country at all. It's been inconvenient for many people, but it's been necessary. And so far, our primary objective has been achieved in terms of preventing entry into the country of many people with infections. We have maintained a lot of the measures that we have advocated and continue to do so. So our primary strategy around the second wave is to prevent it. And so far, we have managed to do so, but it's a very fragile situation. If we let down our guards because of some inconveniences, then we're faced with a situation where things escalate. So we want to keep working hard at preventing a second wave. If we get to that stage where things get out of hand, then we have to sit down and rethink our strategy. And we have contingency plans in terms of what to do. We have really encouraged every state, even when your treatment centers are not occupied presently, to please keep those treatment centers, isolation centers going. Keep the staff employed. Don't shut them down, because we are not out of this completely. But we hope not to need them. So we want to continue working on the prevention strategy in Nigeria.
Okay. My next question has to do with vaccines. What do you think? How is Nigeria going to get the vaccines? How many vaccines are we getting? We are meant to understand that 95% of it is, of the efficacy is ready already. So how do we get it?
So I think the vaccine, firstly, we're really excited, to develop a vaccine in 10 months. if you had suggested this 5-10 years ago, people would have thought that it's science fiction, that it's simply not possible. So it's been incredibly rewarding to see science produce a vaccine in 10 months with 95% efficacy reported. And we have 3 already announced, and there are a few more that will be announced before the end of this year. They will have various pros and cons, the efficacy levels, costs, how to store them. This time, for one of them requires refrigeration of -80, the other is -20. -20 will be normal freezer temperatures. So there will be pros and cons of the different vaccines. Our primary pathway to access in Nigeria is through the COVAX facility. It's a facility developed by the World Health Organization together with 2 organizations, CEPI and Gavi. We are linked into that coalition through the National Primary Healthcare Development Agency. And we are working with them to firstly ensure that we have access to sufficient doses, but secondly to prepare ourselves. Because if you had the vaccines now, they still need to be given to people. So what is important, yes, you need the vaccines, but it's the vaccination of people that will save lives. So you need to store the vaccines, you need to get them around the country, you need to make it easy for people to come forward, organize all of that. So there's a lot of organizational work that needs to happen that we're doing at the moment, while working through MPHCDA to make sure that we have access to 1 or 2 of the vaccines that work. But I'm confident that as the year progresses in next year, 2021, and once the programs start working and delivering, nobody in the world other than those that were part of the trials so far have gotten the vaccine. So as the vaccine becomes available, Nigeria will be very proactive in accessing whichever of those vaccines is best suited for our context.
My last question probably would be, what NCDC doing about endemics in Nigeria, most especially when you have to look at some of the outbreaks that is coming out. You talk about yellow fever in some states now, it's coming out. What is NCDC doing? I'm just using yellow fever as an example. There's so many of them, but what exactly are you going to be doing to prevent any outbreak?
So I think, COVID really has thrown the Nigeria Center for Disease Control into the public limelight. But in reality, this is what we do every day. We look around, we have our surveillance systems, we try and prevent, detect, and respond to outbreaks. So this is what we do every day quietly. We've been developing our capacity, the capacity of state governments around the country to do so. We inform Nigerians when there's a season for one outbreak or the other. We try and let them inform other citizens on what to do about one disease or the other. And it's different. You have meningitis often in the northwest, Lassa in Ondo, Edo, Ebonyi states predominantly, but now in many other states in the country. Now we have yellow fever. So there's a combination of factors. And what the Nigeria Center for Disease Control does is to ensure that there's sufficient focus on these things. And I'm extremely proud of the group of people working, Nigerians working very hard to keep Nigerians safe every day. Few months into the outbreak, there was overwhelming evidence, both in terms of countries where face masks were used consistently, and also in the more detailed science around actual transmission of viruses, that face masks initially were thought to only prevent people that had the infection from transmitting to others. But now there's increasing evidence that there's also some protection for those that are not infected from getting infected. So I think there's fairly widespread consensus now in the scientific community that wearing of a face mask, it may not be 100% effective in prevention. Very few things are, but it really reduces transmission, the risk of transmission when people are gathered, especially indoors, especially if you're not up to 2 meters apart.